My name is Scott Connard. I'm a family doc for 35 years, but the real story of my career is figuring out how to add years to your life and life to your years by empowering you to take control of your health. And what I discovered in my practice was it's not about what the doctor says, it's about how well the doctor is informed about what's going on so they can make the best decision, and then it's about how well those things are carried out and how you and I as patients navigate the system. So I'm really excited to be here today with a personal health assistant who has been doing an amazing job helping people add years to their life and life to their years. So George, would you share a little bit about yourself and your story, how you got here today?
Yeah. So my name is George. I've been in healthcare for about 10 years now. Started in EMS and then moved along to the ER, worked as a tech, got very involved with the patient. I loved it. I loved informing them about their diagnosis, the medications that we're going to take, what pathway was going to be the best pathway for them afterwards. And then I decided to get a degree and just put this into, just consolidate all this experience I've gathered and got a degree from the University of Texas at Dallas in healthcare, which just culminated everything I've learned so far. And now I'm a personal health assistant, and my job is just to be there, as the name implies, your assistant, get you the right care, the right place at the right time, and just walk along with you in this healthcare journey.
Wow, and I know you do that so well. I hear so many compliments about the way that you support people through the journey. And you've been there in people's houses when they were scared and having problems, and then in the emergency room working there when they came in, and now, what do you enjoy most about being a personal health assistant?
Dr. Connor, I believe it's just being there when the person needs you the most. At times it's sometimes just making them that appointment for them with their primary care doctor, and at times it's walking them through their cancer journey, and so that just being there makes, it's what the fulfillment in this career.
It strikes me that there, from my perspective, about 3 or 4 things that you do, but I want to hear it from your perspective. Number one is that I've always been acutely aware that the first time a person's diagnosed with a condition, it's the first time they've probably heard of the condition or had to live it or had to figure out what does that mean, how does that work, and that's a disaster if, in the sense, they don't know what to do. The second thing is that the healthcare system today, the way it works is people want to make money off of patients, and so people are constantly getting hit with huge bills and inappropriate care, and it's really scary. And the third thing is it's really hard to find the best person to go to. And you solve all 3 of those problems at some level, don't you?
Yeah, I mean, from the moment they schedule that appointment, I've had through members, through their employer-sponsored biometrics, that they learn, my cholesterol's through the roof, my blood pressure is not controlled. I didn't realize my hemoglobin A1C was that high. And then we create a pathway, we schedule them with a doctor, and we just walk along with them throughout the whole journey, and then find the best option, like you said, the highest quality care provider, educate them. We keep going through along the pathway, we make sure they get their medication set up, and eventually we follow up and we just continue this journey in healthcare.
It's amazing how much time people waste going through what you just talked about, and you understand it could be very efficient and easy and very reasonable financially, but they're having to learn it for the first time. So what a blessing to have you walk them through the process. And I think about other diagnoses like cancer or multiple sclerosis or some of these other conditions where it's theoretically, potentially life-threatening, and how hard is it for a person to be told this is going on, and then as a doctor, I don't have time to sit there and say, how does this make you feel emotionally? How's this going to affect your life? And how do we deal with daycare and transportation and supporting your husband and wife and all these things? And then how does your insurance work so that we make sure it's all covered? And how do we find you the best specialist? I can't do that, but
Yeah.
You have the tools to be able to walk and support people through that process, don't you?
Yeah, I've had members find out they have cancer through a portal because the doctor did not have the time to call them. 2 days passed, they still had not received a call from their doctor, and we got the call. The member called me and told me what was happening. I gave her my full support, undivided attention, We set up a plan again. I explained the resources, second opinions, and everything that she had access to. By the end of the call, she was very thankful. Unfortunately, she was in this situation, but we were there to be there with her.
Yeah, it's so funny because as a doctor, like, when I say the words hypertension, diabetes, high cholesterol, I know exactly where they are and what's going to happen if they don't do the right thing and what's going to happen if they do the right thing and how they can live a normal, long life if we just, get the numbers, the biometrics you talk about, the goal. But if they don't, they're going to go into kidney failures, have strokes, heart attacks. And sometimes for me, it's like, hey, if you choose not to do the right thing, I'm not your mom or dad. I can't make you. But it's not fair to the person because they don't even understand what those words mean or what's going on inside their body. But you're able to be with them and understand what they understand and why it's important. Because as you say, I feel fine and I am healthy. A lot of times you can feel fine, but if you don't take action, it shortens your life or makes it not as much fun. The other thing that strikes me, though, is how hard your job must be when you're reaching out to people and you're calling them, and they don't really understand what you want to do with them, and they get a little bit like, who are you, what do you do? What's that like for you?
Yeah, that first call, it can be difficult. It in the sense, difficult a little for me. We walk along, and I explain to them and tell them that our calls are confidential. There's nothing to be concerned about. Employer will not be informed. I am there to support and assist, as the name implies, my personal health assistant. I'm going to be your assistant for this journey that we're going to go through together and just get you the best health care possible.
It's funny because I want to, this is the first time I've ever said this out loud, I think, but I wish patients would use doctors for what we're good for. Like, we're good for taking in information, putting it through all of our experience and all our knowledge, and saying, here are the 4 things we need to do. And then what we expect is to say, hey, George, go do these 4 things, and you're going to go, oh, I understand that completely. I mean, you go here and here and here and there and do this. Got it, I'll do that, right? Which is just so naive, but we're in a catch-22 because we can't walk you through that. So to have you actually changes people's lives, doesn't it?
Yeah. A lot of times, especially as you said earlier, they get that diagnosis for the first time. They're in shock, right? Their emotions kick in. They can't absorb all the information that's given to them. So after the visit, I like to reach out to the member and explain and just debrief the whole visit. And what did you talk about? What was told to you? Let me give you some more resources. Let's go through them and see what you understand and what you don't. And then at the end of the call, they feel more confident, more in control, and in power of their health.
So George, you make such a difference, and you're so wonderful with the way that you help people. I just really want to thank you and acknowledge you. And I hope that through this video and through other communications, people, when you call, will see you for the blessing you are, and they'll pull you toward them and help you navigate them through their lives.
I'm not sure about the blessing, but it is a job that brings fulfillment to me.
It's fantastic. Thank you for all you do for people.
You're welcome.